My name is Raul Oranas, and I'm going to perform a tracheostomy care with a patient. Okay, first, we're going to gather the necessary equipment, the trach kit, the NSS, and then we are going to enter the patient's room. Now, introduce yourself and then identify the patient by name and the date of birth, and then explain the procedure that we're going to do at tracheostomy care. And then after identify the patient, we wash our hand, and then we go to the working station, prepare our working station. Okay, this is our tracheostomy kit and the water. And okay, we open the tracheostomy kit. Here. Okay. This is the gloves, sterile gloves. We're going to open the sterile gloves. These are our sterile gloves. Okay. We follow the 1-inch rule. So this is it. Because right is my dominant hand, so I'm going to put gloves on my dominant hand first. So put and we're going to fix that later using the van. Now we can fix that. Now we are sterile to sterile, and then we remove this. And we get the drape. The shiny parts will be on the surface of your working station. And then we have the gauze. The fenestrated dressing, steel brush, the Q-tips, and the pipe cleaner and dryer, and the string, but we don't use string anymore. And then we have this container. With 3 compartments, okay? And next, we put, using our contaminate hand, pretend this is sterile water. 1, 3. You put the patient on your comfortable height position, the bed I mean, and then put the patient on the semi-polar position, and then we pretend we auscultate the lungs, and then after that, we release the oxygen, put it on the side, and then we are going to release or get the inner cannula. Release it, turn it. Once you hear the click, pull it out gently. Soak it on the first container. Now, while we're soaking it, the inner cannula, we can go back to the patient and clean using the Q-tips. Soak it on the NSS. We are going to clean the faceplate inside out. Then once you clean it, throw it, and then we dry it. We're using the gauze. And then she was the gauze. We remove the soil fenestrated dressing, and then we clean using the Q-tips again. With the NSS, we clean around the stoma, and then after that, we dry it with another 4x4 gauze. Be sure you're not touching the stoma. And then after that, we put the new fenestrated dressing. Be gentle. And then, so we're done. We'll go back to the inner cannula using steel brush. We clean it inside out. Then after that, soak it in the second container. Tap it using a pipe cleaner. You dry it inside. It's two-way. You dry it like this. And then put it back to the patient. Make sure you lock it, and then give the oxygen back to the patient. And then we clean our station, working station. And then we auscultate the lungs of the patient. Pretend I'm ausculting the lung of the patient. And then put the patient on a comfortable position. Put the bed in the lowest put the patient in her comfortable position. Bed in the lowest position. And after that, ask the patient if he feels comfortable, feels better, and then after that you give the call bell and wash your hands and document the procedure.